The risk management plan is a really important part of your business plan. So we'll have a look here at what's expected in regards to doing this as part of your business plan for this assessment task. So along the top, we've got our risk, so a description of the risk, the likelihood, whether it's highly unlikely, unlikely, likely, or highly likely, the impact. So this is if it does occur, what's going to be the impact, whether it's going to be high, medium, or low, and what actions will you take to mitigate the potential risk to your business. So this is a really important one to work through to make sure you're keeping your business and yourself safe. So here I've provided some examples. So this is for myotherapy. So you've performed dry needling incorrectly and caused injury to the patient. So that's the risk and that's the description here. The likelihood of it occurring is unlikely. Again, the impact though, if you do it and hurt someone, the impact on the person is high because you can do some serious damage. So here I've written, and this is the important part to say, okay, this is what I'm going to do to prevent this from happening or to reduce the impact if it does happen. Because again, there's some things that can be out of your control, but you need to try and consider them as part of your strategy. So I'm going to maintain industry standard treatment procedures for dry needling. Going to keep my knowledge current for dry needling through professional development in case something changes, and maintain the required insurances, and you'll see that come up a fair bit. This is one here that can sometimes be a bit outside your control because often someone that appears fairly fit and young can still have a heart attack. So client has a heart attack while training. Again, the likelihood is unlikely, but again, the impact is high because they could potentially die. So what you're going to do to reduce the impact of that or minimize the chance of it happening is you're going to screen your clients properly using a proper PAR-Q. So I've written an industry standard PAR-Q here and use the appropriate procedures, whether it be medical clearances, all these things that you've learned about in your course. They become really important. Prescribe and instruct exercise intensities appropriate to the client. Again, that can vary a bit, but obviously you wouldn't want to be doing something totally unreasonable. So if you've got an 85-year-old person who's never trained before and you've got them doing high intensity interval training, that would be seen as being inappropriate. Maintain your first aid skills and your equipment. So you've got your equipment, and at any stage you've got your first aid skills up to date with your CPR and your first aid. And again, maintain required insurances. So the next one I've got is bad publicity via social media from unhappy clients. So again, I've got the likelihood as moderate because it's probably more likely to happen than this and this, especially if you're not on your game all the time in regards to the services you're providing. The impact could be medium, it could be low, it could be high. I guess here it depends upon what you've done to make this person unhappy and what they're going to report about on social media, and also their reach. But just be mindful, this is something more and more businesses have to be mindful of because people can reach a lot more people than they once could. In the case of this, you need to develop a complaint strategy that allows clients to log issues. So rather than going to social media, they've got a method to complain to you, so you're aware of how they're feeling. And again, request regular feedback and respond to clients in a timely manner. Again, if you're requesting that feedback, you're finding out if someone's frustrated or got issues. And again, you can change your procedures or your workouts or the way you treat people as a massage therapist before it becomes an issue. And again, that they go use tools such as social media to vent their frustrations. So for this part of the business plan, we hope that you could go through at least 8 risks. Remembering this isn't just risks associated with your client's health and safety. This is risks that could affect the business. So we're talking about things like a lack of clients, competitors coming in and affecting your business. All these things are risks to your business where you need to analyze them, the likelihood, the impact, and a strategy you would put in place to mitigate or minimize that risk.